My name is Michelle Simone. I am a mother of 4 children. I'm married to Mark Peters. He's a plastic surgeon. I went to medical school. I'm a psychiatrist. I work with veterans at the Veterans Clinic. Well, thinking about a woman's perspective of dealing with being a mom, dealing with going through pregnancies, going through childbirth, all of those things, it's the most exciting, most wonderful part of your life, but it also takes a toll on your body. One of the things that I noticed after I had my first son, and he's now 24 and a half years old, is I remember getting up to try to move around and do some exercise, and he was sitting there in his little bouncy chair, and I remember jumping up and down to do something and thinking, oh my goodness, I am peeing on myself. 4 children later, one of the things that you really deal with is a lot of stress incontinence as a mom. And I'm very active. I love to exercise. It's one of my hobbies. That's a crazy thing, I know. And it really has had a big impact on my life. If I'm going to go out for a run or I'm going to do some sort of exercise class, I always have to make sure there's a bathroom close by. So it becomes very frustrating for me. So one of the things that I heard about Votiva is it really addressed that issue. In terms of safety issues with Votiva, I felt very comfortable because you were doing something that you could visually see. The recovery time is 0, and there's no risk of infection. There's just virtually no risk compared to something else that's a lot more invasive. I actually have only had 1 treatment so far of Votiva, mainly because of my busy schedule and their busy schedule here. But even with that 1 treatment, I had the entire treatment. I had everything done, internal, external, Forma V and the Fractura V. The results so far have been very good. I'm looking forward to having 2 more treatments to have complete resolution of urinary incontinence. Women in general struggle with taking care of themselves. We always put everybody else first. We put our kids first, we put our husbands first. I have pets, I put them first at times. This is something that is so central to women's being, taking care of yourself. And this is something that I think a woman, especially a woman in my situation, someone who's had several children, who has some of the issues that a lot of middle-aged women have with the urinary incontinence, vaginal dryness, concern about appearance, all of those things, you deserve to take care of yourself. You deserve to look into this, have a consultation, see if this is the right treatment for you, and take better care of yourself. And this would be one way to do it. No one else can do this for you. And actually, you're going to be the only one who really knows. You're not going to walk out looking different, but you're going to feel much different. You're going to feel more confident because you know that you can go to a Mardi Gras ball and dance and have a good time and not have to worry about going to the bathroom every 5 minutes. You can go out for a walk with your friends, and you can have a better, possibly, relationship with your spouse in terms of sexual experience. There are just so many ways that women don't take care of themselves. I think this is very important to put yourself as a #1 priority at times.